Today I shall be talking about ankylosing spondylitis. Ankylosing means when the bone fuse with each other due to some pathology, and spondy means spine and itis means inflammation. There is inflammation in the spine. Arthrodesis, when the bone fusion is done by surgeon, it is called arthrodesis. Suppose this is the femur and this is the tibia, and this get fused, and if this get fused due to some pathology, it is called ankylosing, and if this get fused by the surgeon, it is called arthrodesis. Ankylosing spondylitis is a genetically determined disease. In 90% of the cases, this is associated with HLA-B27. Primarily, it involves the axial skeleton, and in this spondylitis occurs inflammation of the spine. Talking about clinical feature, in this there is low back ache, morning stiffness. The patient will feel pain early in the morning. In rheumatoid arthritis and in ankylosing spondylitis, morning stiffness is present. When the morning stiffness is present because when the patient is sleeping, there is not enough blood flow, and all the inflammatory mediators accumulates, which cause pain. But in osteoarthritis, as it is degenerative disease, there will be rough cartilage, and while walking there will be friction, so the patient will feel more pain in the evening after whole day of work. But in rheumatoid arthritis and ankylosing spondylitis, the patient will feel pain early in the morning and will feel better after doing exercises or work of the home. In this, hyperkyphosis is seen, stooping. This is the normal vertebra. Normally in the thoracic vertebra, kyphosis is seen, and in the lumbar vertebra, lordosis is seen. But this kyphosis is increased in the ankylosing spondylitis. Extra-articular manifestation is also seen in the ankylosing spondylitis, like uveitis is called inflammation of the uvea, cataract, glaucoma, inflammatory bowel disease, and IgA nephropathy. Now talking about the investigation, on X-ray pelvis, the earliest sign is haziness seen around the sacroiliac joint due to inflammation of the sacrum. Cervical, thoracic, lumbar, sacral vertebra. Firstly, the sacrum will be involved, then it will move proximally, then lumbar, then thoracic, then sacral. So first involved is sacrum. So earliest sign is haziness around the sacroiliac joint, which is due to the inflammation of the sacrum. And juxta-articular osteoporosis, squaring of vertebra is seen. Suppose this is the normal vertebra in lateral view, then there will be squaring of the vertebra. It is also called erosion around the periphery of the vertebra. It is called Romanus sign. This is the normal vertebra, and there will be erosion and the squaring, then formation of syndesmophytes, then total bony bridge will form, which is called bamboo spine. In X-ray, railroad track sign is seen. It is the interapophyseal ligament ossification. Suppose this is the vertebra, and the interapophyseal ligament get ossified. And dragger sign is seen, which is the interspinous ligament ossification. Suppose this is the vertebra, and the interspinous ligament get ossified. And trolley track sign. In these both patterns simultaneously get ossified. Interapophyseal ligament and the interspinous ligament both get ossified. And for the treatment, non-steroidal anti-inflammatory drug is given, and TNF alpha inhibitors, infliximab is given, and if there is deformity, then surgery needs to be done. This is all for ankylosing spondylitis. Thank you.